Hello there, a very good morning to you and welcome to NTV Medical Matters here on NTV. My name is Viola Xasia and this show is supported by Bill and Melinda Gates Foundation. And as we enter into the festive season, it's in order that we talk about dental care in children. What is it all about? What should we look out for when it comes to our children and keeping them safe throughout the festivities where they get to enjoy a lot of sweet things and a lot of other stuff, provided they are eating. So we have a doctor here in studio with us, and that is Dr. Esther Lukwago. She is a dental surgeon based here in Kampala, and we are going to look at dental care in children this morning. But yeah, we might just think about maybe black teeth or something like that, but what else is hidden that we do not know and should be exposed on this show? Just follow us, and we are streaming live on X as well as all our other social media platforms at NTV Uganda to be a part of the conversation. And later on, you can call in and ask questions regarding your children and the health of their teeth. You're welcome once again, so let's dive in. And Dr. Esther, you are welcome too. Thank you. We are matching colors today. I'm very surprised.
Thank you, Viola, and good morning to you.
Yes.
Good morning, all our viewers. I guess great minds think alike.
I know.
Thank you. I appreciate being here.
Okay.
And it's a good opportunity for me to be able to address, especially parents.
Yes.
Because, you know, with children, the information goes to the parent, more or less. So it's a good opportunity for me. Thank you.
Okay. So let's dive in. What should we know about dental care in children? I wouldn't want to focus on the negative one. Not all kids are sick, but what should we look out for as parents now that we're going into a festive season and the kids' teeth are at the center of this?
All right. So the festive season obviously comes with a lot of feasting, obviously. There's a lot of cake to be had. There's a lot of treats to be given by Santa or Father Christmas.
Oh my, yeah.
And the kids are in their element at that point,
Yes.
okay? But as a parent, we must always be clear that this is just a moment in their life. We shouldn't allow it to get into a situation that would affect them much later. So moderation in everything is critical. Let them enjoy, yes, but bear in mind that moderation is critical. So the real things, that the cornerstones for dental health have always been three. Nothing much has changed there.
Okay.
You have to watch your sugar intake, you have to clean your teeth, and then you have to visit the dentist who is in a position to recognize what is going wrong and then help you put it right in a timely manner. So
I think we should just start from the beginning. Yes. What should healthy teeth for a child be like?
All right. Healthy teeth for a child, most kids will begin growing teeth at around age 6 months. And at that point, once the tooth is in the mouth, it can get decayed, okay? I know there's an old wives' tale that believe that children's teeth can't get sick. Yeah. They do, as we are seeing quite a lot these days. So once a child has grown some teeth, it's time to start cleaning. In the very early stages, of course, it's mostly going to be gentle methods like using a piece of cloth with water or a piece of cloth with a baby toothpaste, any which way that the child is comfortable with, all right? And as they get a bit older and begin to grow back teeth, then we can introduce the toothbrush. Usually still small and soft, that can be comfortable in their mouths and that their hands can actually hold in that manner.
What is back teeth?
That molars in the back side of the teeth.
At what age is that?
This we tend to see beginning around age 2, between age 2 and 3, the back teeth have come in, all right? So now, unfortunately, once the child has been weaned off of the breast milk, then we get into the really, really problematic time. We're getting into formula, milk, porridge, juice, and most kids will start off with a bottle. These drinks will be placed in a bottle. And a bottle in and of itself isn't really problematic. It's when we overdo it, you know, allow the child to go to bed with the bottle, because many of these kids, you know, they don't go to sleep just easily. They need some assistance. And a bottle, as they suck on that teeth, it's really comforting for them. So many a parent or a caregiver find themselves comfortably leaving the child with the bottle through the nap time or through the night. And this has caused untold decay to children. We're calling it early childhood caries or baby bottle decay, and it's becoming pretty rampant. It's actually a bit scary. Many times when a child comes into the clinic, ages 3, 4, you have an indication that it's probably that. But apart from, you know, if one can avoid that, children really are pretty easy to take care of. If a parent can model behavior from an early age, children like to imitate. They're going to do what you do, okay? So if you can brush with them, do your thing, the next thing they're going to want to do is grab a toothbrush.
Social media influencer moms doing the same with their kids.
Exactly. Children, you know, they're not necessarily going to do what you tell them to do, but they're going to do what they see you do. Okay? So it's important that in those early days, early months, you brush with them. Preferably if there's a mirror in a bathroom, stand right there with them in front of you, brush your own teeth. And the next thing they're going to want to do is grab a toothbrush and try on their own. You can make it a game.
You talked about
your turn, then you have your turn.
Okay, and you spoke about having a baby bottle in bed, which is not right. Where does the pacifier then come in? I've seen kids
now the pacifier would play the same role. I mean, it's comforting the child, and a pacifier in and of itself wouldn't be too problematic if it's done and maybe stopped by about age 3, okay? But some people dip it into sugar or dip it into honey. They do.
I have never seen that.
They do. So when you add this artificial sugar on it, then you get into real serious issues also. So whether it's just the bottle or the pacifier, as long as it has sugar in it,
You've seen children, I believe you've seen children that use a pacifier for long and their teeth get projected outside. Have you seen that?
Oh, yes.
And what can a parent do that is watching and wondering what to do for their child whose teeth are now projected outside?
Usually we won't worry too much about this until the adult teeth come through, frankly. Okay? And that's at about age 6. Kids and girls will get them early at 5. So whether it's a pacifier issue or it's a thumb sucking issue, because that is actually a bigger problem than the pacifier, it can get teeth out of line much more than just the pacifier. Usually when the child begins to get the male teeth replaced by the adult ones, that's when we begin to worry. If the habit hasn't been broken by then the dentist may have to help you. There's something called a habit breaker that they'll be able to fabricate and place in your child's mouth, which will literally force the child to drop that habit.
What are some of the dental illnesses that are very common in your practice that you've come across today?
Especially for children?
Yes.
Children, it has always remained cavities, by far. By far, cavities are the biggest thing that we see among children. Developmental defects here and there are few and far between. I'd like to talk about maybe the tongue tie, okay? That is something we know historically as an impediment to speech development. And if not caught early, it can really have a negative impact.
What is it?
There's a little, we call it a frenulum, there's a little tag under the skin, which if it's too fibrous or too tight, limits the movement of the tongue as the child is beginning to speak. And that can delay speech or make it really uncomfortable. So that, if noticed early by a dentist, it can be released at an opportune time. The lip tie is not something people are very clear on, but the opposite can happen on the lip, causing the gum to show, too much of the gum to show when the child smiles. That is more of an aesthetic thing. It doesn't look good, So if one can correct that, that's also possible. Gum disease in children is an issue, but frankly not as much as the cavities. And the cavities, like we've said, the snacks out there, Once the child has begun school, for example, we get into difficult territory, where there's all these birthdays at school, sometimes just the snacks provided at the school, even by the parents themselves. The convenient snacks out there in the supermarkets tend to be pretty sweet snacks. And I think parents find it easy because it's what the kids accept without fighting, So parents find themselves constantly giving them to the children. The sugary drinks, many out there on the market. So the parent has to be very vigilant, Moderation, and then step up the brushing once the child comes home. So brushing at least twice a day is critical. We almost all manage the morning brushing, but the night brushing is a little problematic. Yet, as a pediatric dentist, I'll tell you that if I could only choose one time for a kid to brush a day, I would choose the night time.
Oh, yeah.
Because a lot more damage can be done at night.
And most likely in the morning, it's mostly for, I've noticed, for bad breath or something. But
Well,
if you
yeah.
brush the night before, in the morning, you may
It's
actually
not
have
so
no
bad.
bad.
Yeah, it's not so bad. And for children, now when we tell adults, it's good for you to brush twice a day at night. It's not an easy habit to pick up once you're an adult. But for children, it's actually possible. If the parents can help them develop this habit and they hold it for life, there are already a good chance of staying cavity-free.
I have
just
seen
by
that,
changing that one thing.
The habit. So I've seen about 40% of 12-year-olds have cavities in Uganda as we speak now. So why is there widespread tooth cavities in the country?
Well, just like I've said, the sugary stuff on the market is just amazing, okay? And some people, sometimes you don't realize just how bad it is, because when you're not the one putting the sugar in your tea or your juice, you tend to think maybe it's not so bad because you're not the one who put it in there. But there's actually quite a lot in all the bottled drinks, the fizzy drinks, the little pastries and the cookies and all that. Never mind the candy, never mind the cakes, okay? So, and like I said, these are very convenient snacks to pack for children, very convenient snacks for people to give even at home, okay, between meals. And talking about between meals, that is actually the most dangerous time to snack on sweets. Yeah. There's a protective element when you eat something sweet with a normal meal. Oh, okay. The action of the rest of the food helps wash it away. It's much more comfortable then. But it's the snacking between the main meals, and if you're snacking on a sweet thing, that increases your chances of developing cavities.
Why do you think, Doctor, that dental cavities in children are usually overlooked?
Well, people believe these are baby teeth. They're going to fall out. Why bother? Okay? And we find that belief very, very problematic. As adults, we tend to forget that actually we held these teeth for like a long time. Some of us didn't remove our back molars until around age 12. Okay? But at 5, they have decayed. And the parent is like, but they'll fall out. Like, yes, but
speaking about back teeth, I have seen that thing where children grow teeth at a very, very little age. And I've also heard that children are born with the back teeth at times. What is that about?
There's a condition called natal teeth, or, fancy names for them. But yeah, the genetic makeup of an individual can make a situation where they are born actually with teeth in the mouth. Now, the way these are dealt with, they'll rarely be strong, good teeth, okay? Usually it's just a little shell of a crown. Is
that not what causes, I've seen kids crying and having a temperature?
Let me put it this way. If that happened, then chances are it's going to be taken care of immediately, okay? Mother is disturbed enough to seek help. And usually, usually the tooth will be taken out. Not so much that it's a problem, but because it's going to hurt the mother while they nurse, okay? Now, when the child begins to teeth in the normal scheme of things, sometimes there's a little something we call an eruption cyst. It's a little swelling that forms just above the developing tooth, okay? It can be problematic for the parent, okay? The child will be quite uncomfortable, okay? Already the gums are pretty itchy once the teeth are coming through. Now, if there's a swelling over that developing tooth, which bursts, okay, this is usually enough to alarm any mother, okay? In and of themselves, they're not really that dangerous. They're really just different ways teeth can come into the mouth, okay? Not in many people, but in some people. So they are usually things that are temporary. And once it makes way, the tooth comes into the mouth, usually it's perfectly okay. Now, the issue of binyo has
actually, do you speak Luganda?
I do.
You should actually speak Luganda so that some of our audience can be able.
I'll try.
Those teeth are something very serious.
Binyo, yes. Binyo. Now, there are individuals where, for some reason, manyo gajakula wesuna than expected. Like I say, different people are made differently. And Mobasinga, it tends to be these teeth, they call the canines, okay? The canine area. So it's obviously disturbing to the parent, okay? And they'll seek help. And traditionally, they've been ground down, literally. Yeah, find a little abrasive material and grind it down.
Does it actually disappear? Oh,
Well,
that's
of
the
course
canine.
You grind it down and it's
That's
gone. That's the canine, yeah.
Not the back tooth.
Not the back teeth, usually.
Okay.
Usually it tends to be the canine for some reason. Now, there are those who will actually extract it out of the gum. And in that process, many times they destroy or they hurt the developing germ of the tooth beneath it, the permanent tooth that is just underneath this one, all right? And that causes issues because now for a while this will be okay, but when it's time for the permanent canine to come through, either it may not come through at all or it will come through deformed. Yes. Okay,
so when you look at children, the cavities, let's say your child has cavities and you leave them unattended to, or you feel they'll be okay or they'll fall out or something. What happens in the long run for a child like that?
All right, let's start with short term. Okay, short term, we both know what teeth are for chewing, grinding our food. Okay, and in the mouth is where the process of digestion starts. The process of the teeth working with the tongue and the cheeks and the lips to soften this food helps incorporate saliva. Now, there's in saliva quite a lot of digestive enzymes. It's during that process that they are activated, okay? And then as the food goes through the rest of the system, well, a lot more happens. But the start is here. If this is compromised, what the body gets out is a lot less. So they also help us to learn to speak, how you form words and letters and sounds. Many times it's the action of a tongue against the tooth, you know, or the lip against the tooth. So if you don't have that, all right, it's problematic. But very importantly, that parents don't realize is that this baby tooth is like a space holder for the adult tooth, okay? That it literally guides it what position to take when the time comes, all right? So if this has been lost too early, all sorts of things begin to change. And then you find yourselves getting into situations where they are so misaligned, you're going to need expensive treatment to get it right. So when you get into braces and stuff like that, all right? But in the short term also, the self-esteem of the child, okay? The child has no teeth, it's being called mapengo from like age 3, you know.
We've all been called mapengo at one point. Would you say that cavities are as serious in milk teeth as in permanent teeth?
Frankly, let me see. I don't know how to gauge the two, but in both dentitions, they're pretty serious. And in my view, maybe that's because I deal with children a lot, because the child depends so much on what they feed on for their development and growth. Compromising it early in life is really problematic. Yeah.
So what should a parent do if they have their child right now and they're watching and their child has perfect teeth, very good, and they take care of them? What is that one food that they should stick to be able to have calcium enough that their teeth stay fine?
Well, plain full cream milk is usually pretty good, accessible by anybody, okay? Eggs are great. Cheese, for those who can manage it, is a pretty good thing to add to the diet. The things that I like to touch on, which we believe are healthy, but can be problematic in certain forms. Yogurt, for example. Yogurt in and of itself is pretty good, okay? And if someone was able to take it plain, amazing. But we all know plain isn't so tasty, okay? So we tend to have
Just thought about it.
Exactly. We tend to have it mostly flavored. Yeah. And with the flavoring comes quite a bit of sugar. Then also yogurt is thick and, you know, it will sit where it goes for a while. So that causes another level of problems. Then milk, like I said, is amazing, but when we flavor it, okay, we add some sugar to it, and we tend to drink the flavored milk through little straws. The straws encourage that constant sipping. Maybe a good time to add that actually it's not so much the amount of sugar or sweets the one is consuming, but how frequently they consume them that will actually determine if a child is going to get cavities or not. The constant little snacking is more problematic than if a child sat down on a bottle of soda and drank it in one go, and later maybe at dinner had a few mandazis and that's it, okay? It's this a little biscuit here, okay? A cookie here, a candy here. That is a little more problematic. That mouth which has its own process of clearing this stuff, the saliva and all that. It doesn't get enough time to do what it needs to do before then the next attack of sugar comes in. So if parents could at least internalize that and try to keep the sweets with the meals, and between meals, get the kids into the habit of sipping water.
We shall actually look at healthy snacks that can be alternatives to this, what we used to.
Sure, yeah.
But then I'm actually very happy that I don't enjoy sweet things like that, so I'm very happy. For the first time in my life, I have a win. Now, I have a win when it comes to not liking cake and all these things.
I had a sweet tooth growing up.
Oh, yeah.
Believe it or not, that's how I even found myself becoming a dentist. Because I visited a dentist at about age 6. I had an issue, and my dentist was great. It didn't occur to me to fear him. So when I was older, I found that the average person fears the dentist. I was like, why? You know, I realized that I probably had been lucky. Mine was great. So it got me onto the path pretty early on, yes.
Okay, so for a parent that is watching and has their child that has cavities or is struggling with cavities, where should they begin?
Where should they begin? With the daily care at home, okay? Step that up. Understand the danger of the sweet things, and like we've discussed, how frequency is really the bigger issue. Then self-care as the brushing. Now the brushing has to be at least 2 minutes, okay? Science shows longer than 2 minutes there isn't really much advantage, but under 2 minutes the teeth are not really clean, okay? There are little videos out there on YouTube. There's so much resource out there that if one really was committed, you can find out what movement one needs to do, okay? Now the child until they're around 7 years doesn't really have the dexterity in the wrist to make those motions we talk about, which is why we always say the mother or the parent or the caregiver should always supervise, okay? Allow them to do so they can learn, but every so often get in there and make sure they're doing a good job, okay? So brush twice a day with a fluoride containing toothpaste, all right? Now the size of the toothpaste depends on the age of the child, okay? Under 2, we call it a rice grain size, okay? You kind of just smear with a very thin layer on the toothbrush. Then between 3 and 6, it's more like a pea-size blob of a toothpaste, okay? And allow them to form as much as they can on the teeth. 2 minutes. If you need a timer, find one, okay? If you need a song that lasts that long, use it. Over time, the child internalizes what 2 minutes is like, even if they don't have a timer anymore. There's a little trick I like to tell my patients. If you can teach the child to spit really well and then not rinse, okay? Allow that little thin layer of fluoride to stay on the teeth a little longer. It's very helpful. Now, once you've done the sugar thing, taken care of that, you've cleaned at home, now you need to see the dentist, okay? Now, the dentist is able to see things you're not able to see, okay? He's able to guide you for your particular case. I mean, the information we give is generic, you know, doesn't apply to everybody. Different kids have different risk factors, and a dentist will be able to interview the parent and realize that this is a very high-risk child. This is moderate. And then how they deal with each child will be a bit different, okay? Children are lucky these days. There's a lot of preventive remedies out there that the dentist can help you with. They can apply fluoride to your tooth in a quarterly manner, okay? And they can seal the back teeth where the decay usually happens a lot. They can put protective sealants on that. All these procedures are painless, happen very fast, okay? Not anything for a child to worry about, no injection, no feared injection. But you won't know until you've gone to see the dentist. You won't know if your child needs this or not, okay? So do what you can at home, but please, please visit a dentist early on, preferable before even a problem comes up.
I understand
the very best, at least the dentist will advise on how to keep it that way.
Okay.
Yes.
I understand it's a bit difficult for these very little children to teach them how to brush or to help them brush. Part of the reasons is they swallow the paste. So what is the danger in swallowing the toothpaste or the foam?
The danger in swallowing the toothpaste is the fluoride aspect of it, okay? There are toothpastes out there that are made specifically for the really young ones, and families which can manage do that. But there are families which can only really have one blob for everybody. Now that's where we really go critical on just how little you can put on that toothbrush. So the issue about fluoride is that it's great for teeth, but it can be too great, okay? There's a limit to which it now can begin to cause issues in the rest of your bones or even in your teeth later on. So it's called fluorosis, and if unchecked, too much fluoride can be a bit detrimental.
Now that we speak about fluoride, let's also chip in for the adults. How much toothpaste should we use throughout our lives?
Frankly,
the size, yeah.
For an adult, you can feel, you know, you can give a good blow to the because, you know, you're conscious enough to spit it all out, okay? And you've got many more teeth than a child does, okay? So you can feel your toothbrush. Literally, I can't demonstrate it here, but yes, you can, the whole filaments, you can cover all the filaments. And then take the 2 minutes. Touch every surface. Don't forget the tongue, okay? All that is critical.
So what does a parent need to buy in order to take care of the children's teeth, apart from a toothbrush?
Apart from a toothbrush. The very young ones, obviously, before they even develop any teeth, it's important, okay? To clean the gums after every feeding, okay? Usually the average parent will use cloth, like we said, or gauze. There are wipes out there which contain a substance called xylitol. Xylitol is amazing in reducing bacterial population and you know, preventing decay. They are little wipes, like regular wipes, but this time meant for the mouth, okay? Then once the teeth begin to come in, the average parent should then begin to move to the toothbrush, okay? A little, like I said, the handle for the child is critical. I think people see them all over the supermarkets. They're shaped a little differently, okay? The whole idea is that so that their little hand can grab it well, okay? They won't be able to grab our regular toothbrushes the same way. And you're trying to train the hand to do that, all right? Floss, believe it or not, even if a child is critical, because many cavities in children are actually formed between teeth, the part where a toothbrush filament can't really reach, okay? So when a parent can, in the early days, you can help the child floss between the teeth. And as they get older, of course, you try to show them, you try to teach them. Mouthwash for children is rare, okay? We rarely recommend that. But yeah, that's it. Depending on the age group, you keep upping up the game.
Okay. So, wow, we actually have a very good picture there on screen that shows our parents watching out there what children's teeth can be like.
Yes,
what is that, doctor?
Now, this is plaque, really. This is a child whose teeth haven't been cleaned well, unfortunately. And the parent may not be aware, because this is probably how it always is, all right? But children's teeth are actually pearly white. Okay, on average they're pretty white. So any yellowing around the edges, really that's a plaque, and those are the exact spots where over the next few months something called white spots are going to appear. They'll appear like little chalky white areas. Now those are the earliest signs of decay, and at that point they're still reversible if the parent is able to address them. But later they'll turn into real brownish spots, and then a real cavity will form if not taken care of.
Okay, so our viewers, we are talking about taking care of your children's teeth as we enter the festivities. I know there is going to be a lot of celebrations and stuff like that. And so the children get to eat sweet things and all that, which could result in problems into the new year once the festivities are out. But also on a regular, kids that snack a lot in boarding school especially. We should actually talk about boarding school. I know that's a very hot spot for children to get tooth decay. But if you're just joining us, it's NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. I am Viola Xasia, and with me in studio is Dr. Esther Lukwago. She is a dental surgeon, especially with children. So that is where we have our focus on this morning. And so, doctor, I don't understand whether there is such a thing as perfect teeth for children or even for an adult. So when I look at my teeth and they're just white, to begin with, what color should the teeth be? But also, if they look normal to me, does that mean they're normal? But if I don't understand whether they're normal or not, what should I do? And how do I find out whether I have perfect teeth or my teeth are in perfect shape, something along those lines?
Okay, so perfection as far as teeth is concerned, yes, the look is important because, you know, we know they really contribute to how a person is perceived by the environment. So yes, nice white teeth for children. I would call the children's one white as compared to adults. Yeah. Adult teeth are a little yellower naturally, okay? The whole composition of the enamel dentine structure is different. So they're a little yellower. That doesn't make them dirty, okay? And as we get even older, they get even yellower. Yellow. And again, that's not dirty, okay? All right. However, healthy teeth isn't just about the look, okay? First, they need to function the way they should. Are you able to bite with the front teeth, tear with the canine, and grind and chew your food with the back teeth, all without pain, okay? The jaws are able to come together without pain there, all right? And if you're lucky, maybe there's no foul smell coming out of that, okay? So that we would call relatively healthy teeth, okay? Now, but mostly people think of the look and like, you know. Now, for those which begin to get stained, okay? The stains will most often start on the inner side, okay? On the tongue side. And they'll appear brownish, you know, gray, all sorts of colors, okay? And it will appear like a plaque that is covering the teeth around the gum line. Yeah. Now we're getting into real dangerous territory then, okay? Your toothbrush can no longer remove that, no matter how well you try, okay? And this is the time to visit the dentist, get them cleaned off, and then at that point, you'll get good advice from your patient, from your doctor, so that you can prevent that happening again, all right? The average adult needs this at least twice a year. For those who really take good care of themselves, they floss, they do this, they brush twice, maybe once a year, okay? So the reason we say 6 to 12 months is because everyone is different, okay? The people who are really actively battling gum disease, those one would probably even tell every 3 months, okay? Because he has an issue that needs to be sorted out. Then there are those who are just keeping things nice and clean. That's why you say maybe once a year, okay? Yeah. Children, on the other hand, also need it. They need cleaning once in a while. Theirs is gentler, okay? And it's in an effort to get them to recognize what clean teeth look like. A dentist may stain the teeth for the child before they start to clean them for them. And that purpose stain is able to show the child exactly where the plaque is. Because, you know, they'll clean, look in the mirror and think, oh, it looks nice. But when a dentist does a bit more, it's like, oh, I missed this spot, I missed this spot, okay? And then in a mirror, they're able to agree that you have a problem with this spot, so pay extra attention, all right? So yeah, that's what I would say would be healthy teeth for an individual. They function well, they look good.
There's been a rising challenge about, well, I did my little own research about how the trend of the foods we're eating lately and how soft they are with the rise of a blender have then made the child's teeth not strong enough. Because I was looking at the braces and they're really common lately, more than upper. So what are the parents not doing right, or what has happened to the food?
Well, modernization has happened, pretty much, okay? Back in the day, we chewed some really tough stuff, okay? Chikaj was just the bare minimum of it, all right? And here's what happens is there are certain bones in your body, the jaw bone being one of them, which genetics decide to some degree what the size will be, okay? But how much you exercise it can cause it to get bigger, all right? Now, when you're born, the size of your teeth are already predetermined. Okay, they are what they are, given what genetic makeup you have, all right? But now the jaw bone can get a bit bigger. So when that too has a mismatch, the size of the teeth and the size of the jaw are mismatched. Yes. Already there's a problem. Now also, if in your daily activities, you don't do anything to actually get this stronger, you know, maybe for some kids, the hardest thing they chew is chips, okay? So that's not going to exercise any jaws. They're going to be the bare minimum they could ever have been. So the teeth and the jaw sizes don't match. And many times we will lose some teeth and realign the rest. But also we are seeing many more children now who, even at around age maybe 9, 10, if you looked at their x-ray of the whole jaw, the last wisdom teeth are not even in the mouth. They're not growing.
Why is that?
We believe it's probably evolution. You don't use it, you lose it. Okay? We've lost the appendix. Oh my God, we are losing the teeth. For many decades, the teeth would be in, but would stay buried. Okay, no space to come through.
Yeah.
Now we're beginning to see generations where they're not even there. The X-ray doesn't show any sign that there's a little tooth developing there. We're seeing more and more of those. So my guess
So what's going to happen in the end?
Well, let's put it this way. Stone Age man had almost double the teeth we have now.
Okay.
Yes, because he needed them.
Yeah.
We are showing nature that we don't need them anymore.
What?
So they're not developing anymore. We will have maybe, for a long time, we'll probably have just 2 molars. That's my educated guess.
Yeah.
I don't know for a fact. And then who knows, over time, as the smoothies increase and all that increases, maybe even just 1 set.
So
Maybe we'll lose the canine because we no longer use
God.
it to, you know, to
that's
tear
actually
into
very
our meat.
scary to me.
Well, I don't know if it's scary because right now we don't find that situation scary.
No, I find
We
it scary
manage
to me. I
somehow.
mean, like, there's so many things that we are, you know, we are not using.
Exactly.
So what then happens to
We
us?
will lose them eventually.
Oh my
We will
goodness.
lose them. That's
Yeah,
just how
so-
the human body is.
So if you're watching, then this should truly, you know, worry you a little bit.
I wish parents
Yeah.
would give a bit more of the chikaju, apples, the mangoes. It helps.
This is a very good moment to talk about the food that we should give our children,
Food,
actually.
I mean, there's nothing that beats. I mean, we are blessed
What?
as a country.
I
to
know,
have the
I'm
food
still
we
stuck
have.
on how we are losing it.
I know, but we are blessed as a country to have the food that we have. I mean, by far, the natural stuff is best. There's not even really anything in nature that I can say is really problematic. Even the sugar in the natural, in the fruits is pretty healthy. Okay, and yes, something happens to it when we juice these fruits. Okay. And not to say never juice them, but moderation. Everything in moderation.
Everything
you
in
know,
moderation.
do a bit of juice, but
Sure.
also eat quite the majority of your fruit, as in
I'm actually
whole.
stressed out right now as I'm listening to you because, I mean, there is an increasing trend on social media. I really watch a lot of influencers
Yes.
and we do what they do.
Absolutely.
Unconsciously almost, we just
Yeah,
follow.
I know,
and I've
I
seen a lot
know.
of grinding, a lot of juicing. I've seen people
That's
grinding meat, actually blending meat. So you don't get a chance to chew any meat.
You don't, yeah.
You don't get a chance.
I mean, they have their moments, honestly.
Yeah.
If you're on the go, you're in a hurry, it's a good way to get lots of nutrition in one little, you know.
Okay.
But that should be for that reason. You should know that it's not the be-all and end-all. So when you go home that night, grab that apple and eat it whole. Okay, grab that cucumber and chew it as it is. Okay, don't depend so much on a trend because it's what's happening here. There's a reason why nature made them whole.
Yes.
If we needed them blended, it probably would have come up with a way to do that. Okay, so fresh fruits and veggies by far. I don't think that will ever change, no matter what the times change like. Okay, fibrous stuff, critical. Okay, tough vegetables.
I'm actually thinking about mangoes and how they get stuck in your teeth. How annoying that is. Very annoying. I can see why people blend some.
Yeah, it's true. But maybe that's maybe that's an opportunity to floss naturally. I don't know.
Also, what you do actually when that stuff gets stuck in your teeth is one of the most annoying things I've ever seen.
You know what? Because this has been sticking in our teeth even before
my
floss
God.
came. But we'll
Yes.
find a way to take it out. Okay.
Speaking of natural methods, what should someone do? Our average viewers are actually in places like Kotido, in Rukunjiri, in Tungamo. They are not living in this fancy life you're talking about. So when you look at a parent like that with their healthy children that feed on that tough food and everything, what are some of the natural methods they should use to be able to have healthy teeth?
That, like I said, the tough foods are already pretty helpful.
In terms of cleaning?
Now cleaning,
Yeah.
there's something we call a muswachi. Okay, usually these people know what shrub, okay, to get this muswachi from. It's not just any random shrub, frankly. Okay, I can't say the names, you know, because I don't have them off head. But I think at some point we used to use the neem tree.
Okay.
At least it was popular in the central area. Different areas will have something slightly different.
I have seen that in Western it would be eucalyptus, those sticks.
Exactly. So it's not just purely a stick that can form that, but there's something intrinsically in that tree that actually is a bit antibacterial or whatever. Yes. So they don't just randomly pick a tree. All right. So, and in the process, they're able to chew on it, get its little ends soft enough to wrap around. Okay? Now, this is not something you can do 2 minutes, obviously, which is why you find they tend to be almost a habitual thing that they do all morning.
I see old men do that a lot.
Slowly, yes, yeah. It's a good way to keep teeth clean. And already, if your food is already quite the fibrous stuff, it has a natural cleansing effect on plaque. Yeah, and chances are you're not really eating a cookie after that, okay, in that environment. So they tend to be lower on these artificial sugars. So nature blesses everybody in their own way. So now the person who has access to lots of sugar also definitely has access to a real toothbrush.
Hello?
Maybe even an electric one, okay? So
Hello?
it's about using it right, yeah.
So let's talk about
Hello?
care. Speaking about caring for teeth, when you have your teeth, and this is in a case where we've seen a lot of braces and stuff like that, trying to realign your teeth. So what is happening in that case where someone literally cannot have their teeth in line? Not just that they were born that way, but like the influences around them. What makes the teeth get out of line that you get to a level you need braces?
Okay. Like we mentioned earlier, losing the baby teeth too early is a contributing factor. Okay, it's actually the biggest factor. There are children also, like I've described, who just by and large the teeth were never going to fit. The jaw was too small to fit the size of teeth, which was already predetermined. Now, when that happens, and you're not in a position to get them aligned, then you've got to be really vigilant.
Are there ways you can align your teeth without the braces?
No, not that I've seen. Let me put it this way. Once in a while, a tooth is so out of line that taking that tooth out may help what's left, even without proactively aligning them, okay? Those are a few cases. Most cases, removing one tooth would only help. In fact, it may make things worse. Yeah, so on average, when the dentist determines that this case can only be helped by removing certain teeth and then lining the other, it's done. Many times they don't need to remove any teeth. They just align them as is.
Okay, at what time should a child have braces then, and how safe is it?
How safe is it? Well, braces, let me put it this way. By around age 8, usually there are signs that the child may be headed that direction. It's a good time to get an assessment then, okay? It's rare that the dentist will start it then. However, many times there's something dentists can do. We call it interceptive orthodontics, where there are things the dentist can do sooner to prevent the braces later. Okay? But then for those where none of that helped, and indeed the child went on to need braces, the early teenage years are usually best. Around the age 12, 13 is when the average person gets braces. When the teeth are still malleable, then you can still move them relatively easily. But that's not to say that adults can't get teeth. We've seen 50-year-olds getting braces. Yeah.
There are kids that sleep and they keep biting their teeth, and I've seen someone put a spoon in their mouth or something like that. What's happening?
There's a habit there. There's called bruxism. Yeah. Even adults have it. Okay, it's a subconscious, an unconscious thing, not something one can. In fact, that person wouldn't even know that they do it. Okay, but like a spouse may know, or a parent may recognize it, and usually it's not something that can easily be. I say the subconscious it's not something that can easily be sorted out, but the damage to the teeth can be mitigated by wearing what we call night guards at night. And sometimes it's slowly able to train the jaw again to stop doing that over time. But generally, we attempt to prevent the damage of tooth grinding against tooth by wearing something protective there.
Is it that milk teeth in children should come out themselves, and when they are paining, what should a parent do?
Ideally, in the ideal situation, the tooth should shake naturally. When it shakes naturally, that's a good sign that it's ready and that its replacement is right there. We're seeing what we're calling, I think it's called vampire teeth, right? Where there's like a double row of teeth.
Oh my goodness.
Yes, and that's usually is happening because, again, the jaw is too small. The natural process hasn't happened. If I could describe that maybe to you, let me call it this way. In the natural scheme of things, the developing tooth sits directly under the milk tooth in the jaw. And as the developing tooth pushes upwards, it causes the little baby tooth, its root to shorten, and that's why it loses attachment and then falls out. And if this happens naturally, by the time that falls out, the other end is very close, just to take its belt, okay? Now, if the jaw is too little and the teeth just aren't quite well aligned, the developing tooth may not sit directly under the other. It may sit slightly off. So that mechanism won't happen. This will continue to come through while this continues to stay firm. You know?
Vampire teeth.
Exactly.
Yeah.
So yes, and this really disturbs parents quite a lot. They come in really quite upset about it. But yeah, at that point, you have no option but to get the dentist to remove them for you because they are firm. You can't shake them. Yes.
Okay. So in a case where a child may accidentally swallow the teeth, what happens
No,
then?
if it's swallowed, it's swallowed. The body will take
Is
it
that
out
okay?
eventually.
We've been
the
told
problem
so
would
many
be
things.
inhaling.
Oh.
Yeah, the problem would be inhaling the tooth, which isn't likely. Okay, but yeah, now that would be problematic. But swallow isn't too bad.
Yeah.
The body will naturally get rid of it.
Okay.
Yes.
Yeah. Usually you hear stories. If you swallow this will happen. The teeth, you know, all that. It's
Well, things happen, but the body usually has a way of mitigating any consequences. Yeah.
And so how quickly should someone address a cavity? Say, for example, there is a hole that you've noticed.
Earliest,
Yeah.
at the very earliest. Like I said, for children, if parents look at their kids' teeth as they're brushing them and they begin to note those little white spots along the gum line, danger, okay? That's the time to address that because actually it's reversible. No injections required, no fillings required yet. But if it goes on longer than that and it begins to turn brown and even forms a cavity, now you're getting into teeth which are sensitive, okay? And once teeth are sensitive, the child is going to reject the toothbrush. Now the plaque is going to touch on even more, just compounding the problem, okay? But when a cavity has actually been noticed, whether painful or not, please address it.
I have seen herbal medicine. I've seen herbalists who talk about reversing cavities. Is that something that is possible? But also, ignoring the herbalists, can you reverse a cavity?
You kind of can. There's something we call remineralization. This will take me a little bit into how a cavity forms. The way a cavity forms is a process of demineralization. Our enamel has this, it's strong, has lots of minerals in it, but the acid formed by the bacteria when we eat sweet things slowly dissolves them out. And that's how a cavitation eventually forms. However, like I said, the body is magical, okay? Saliva is meant to reverse some of these things if it's given a chance, okay? Or it's helped along. So the remineralization can happen slowly, and especially if helped by other adjuncts in the toothpastes and whatever, it can actually happen. What I believe happens is that these herbs are probably able to support remineralization. So that's why they say that, oh yeah, cavity can actually stop paining. That's because the minerals have leaked in to a good degree and the pain has stopped. However, because the defect remains, then food is always going to pack in there. So the real definitive treatment would be to have that filled up.
Speaking about treatment and filling, what alternatives are there when it comes to addressing this? We are winding up, so what alternatives are there apart from plucking the tooth out, the filling, and they're very uncomfortable. I've had one myself, so please walk us through that.
Like I said, if caught early, you can remineralize these early spots, okay, without any trouble. But once you've gone past that, then a filling is almost inevitable. Once there's a real defect in the tooth, a real hole, okay, you can still get a small surface filling if it's caught early, where you may not even need anesthesia, we may not need numbing, okay? But once it's reached maybe the dentine, like that middle part which is sensitive, most likely you're going to need numbing, and then the decay needs to be cleaned out and a filling placed there. Should it not be caught then, and it's gone further down to maybe the pulp, what we call the nerve center, now we are talking root canal, okay? So, and if all that fails or none of that is possible, usually that's when we'll take a tooth out.
Yeah.
Yes.
Okay, so at that stage, is there anything else someone can do? Or, so once the tooth is taken out and you've taken out one too many, what then happens to you? Do you walk around with these holes?
Absolutely, yeah. These are stuff that maybe the early dentist didn't even realize. The consequences of tooth loss are actually pretty serious, okay? So the rest of the teeth will shift position around. Yes, they will.
Oh my.
And that can cause untold issues later. So let me paint you a scenario. So you've got your molars, and then you've taken the middle molar out. So what the other molars are going to do is they're going to not shift to close the gap, but they sort of tip in, okay?
Wow.
And when they do that, they begin to leave gaps between the other teeth because they shift a bit. Then you begin to get food, like meat, chicken, the fibrous stuff begins to get like, it's no longer comfortable to eat meat. It's no longer comfortable to eat chicken. And then you come for a solution. Many times by then it's too late, okay? The gap has closed. I can't even fit a tooth in anymore, an artificial one. And it may require me to give you braces first, to first push those teeth back where they should have been, recreate that spot, and then give you maybe a denture or an implant or something. So what we are suggesting now is, if you must lose a tooth, make arrangements to replace it, because the consequences that later come with tooth loss are quite serious. Yeah, those areas are hard to clean around the gaps, so you're going to end up with more gum disease. And gum disease, if I may be allowed to say this, I know I said we don't usually see it in children, and we're mostly talking about children, but let me slip this in. Yes. Gum disease is the silent problem in dentistry. It's mostly painless. For years, you can have it developing in a painless fashion. A bit of bleeding here and there, but it goes away, you ignore it. By the time you get real symptoms, it's really, really advanced, and many times it can't be reversed anymore.
Okay.
So this is why the dentist is always telling you, come for that cleaning. It's critical to prevent that.
Okay, so as we wind up, do you have anything else you think we should know, our viewers and I, that we need to know for our children when it comes to taking care of their teeth, finding solutions, and how available are those solutions, how affordable are they, and then,
I'm passionate about prevention, personally. So whether the child has an issue or not, you know that they're out in the world where this is always possible. I mean, you're not there to police them at school. You don't know what they're eating. Do what you can to prevent what you can. Do the quarterly fluoride application, which actually strengthens teeth, encourages remineralization, and makes possibilities of decay much, much reduced. Once the back teeth begin to come in, especially the adult ones, seal them. We call it a sealant. Okay. It's painless. It's pretty simple to do. At least know, give yourself the comfort that I've done what I can to prevent. Yeah.
Okay, so this is your moment to actually, if you'd like, to share your contact or where you can be found.
Oh, all right. Like they said, I'm Dr. Esther Lukwago with Kate's Dental Clinic. It's a clinic in Kamocha on Kanjocha Street and on Parliament Avenue, Batia Chambers. We are a multi-speciality clinic. That means we deal in all sorts of dentistry, adult, children, and my contact personally is 0772 465051. Like I said, I'm passionate about children and families, and I love prevention above everything else.
And I've seen that you like to keep smiles on people's faces, children's faces. Yes, so thank you so much for joining us for today's conversation on dental care in children. And
thank you for having me.
Yeah, and so Doctor, that brings us to the end. We shall let you go. And dear viewers, thank you so much for making time to watch NTV Medical Matters. We're always here Monday at 10 a.m. I am Viola